Hi class, my name is Caitlin Rice. I'm going to be going over multiple sclerosis, more commonly known as MS. So you may have heard of this disease before, or maybe know someone who's been diagnosed with it. But I'm just going to go into a little more depth as to what is it, epidemiology, treatment, that sort of thing, and then of course how exercise would affect these type of individuals. So first, what is it? It's a chronic disease that affects the CNS, so that's the brain and the spinal cord. It's also thought of as an autoimmune disorder because the immune system actually attacks the myelin sheath, which is the protective covering around the nerves, which you can see in this illustration. That is destroyed by the immune system, which will cause permanent damage to the nerve, and that's going to lead to the symptoms that people experience. So 2.1 million people worldwide are actually affected by MS, according to ACSM, and the cause of it's actually still unknown. There's no known cause, but it's thought maybe a virus or a gene defect could be, or possibly looking at hormones, because women are 2 to 3 times more likely than men to be diagnosed, so they're like a hormone difference could be the either susceptibility or prevention. So that's still being researched as well. The age range is pretty big. 20 to 50 years old is the average, but could even be younger than that or older than that. And then as far as race, it's kind of seen all across the board. All ethnicities are affected. It's just more common in the Caucasian population. So looking at the symptoms, there's a wide range here, which you can see, anywhere from vision problems, tremors, gait issues, all sorts of things. Really affects the entire body, which you can see here through this muscular skeletal man. It affects all parts of the body. And as far as specific symptoms go, it's very dependent upon the person. Everyone experiences MS a little differently, so what symptoms one person experiences is not going to be the same as what someone else experiences, as well as the severity and frequency of them as well. As far as diagnosis, there's no one specific test that can diagnose a person with MS. It's more of a collection of multiple things, like lab tests or physical exams, that sort of thing, which you can see here. MRIs are a very common one, or just what you can see here. They're going to be used to find these little plaques or lesions, which you see. That's what the doctor's going to be looking for. That's going to be a major sign of MS. So they're going to do all these, and once they do that, they're going to look at the criteria. So there must be 2 or more findings in the CNS where there's damage, which is what we just looked at, and those damages must occur at least 1 month apart from each other. And lastly, they have to be able to rule out any other types of diseases that may go along with the symptoms that they're experiencing. Obviously, you saw the list is pretty long, and they're very common to a lot of other diseases as well. So they have to be able to rule out anything else to make their final decision. As far as the progression, there's 3 different types. So there's relapsing remitting, secondary progressive, and primary progressive. Relapsing remitting, real quick, is the most common. There is really no progression, which is nice. The person's just going to experience their symptoms, and then they're going to go into a remission period where they're either dormant. Whereas secondary progressive, hence the name, is a progressive form of MS. So their symptoms are going to be increasingly worsened, unfortunately. A lot of times this is diagnosed a lot later in life. People usually have the RRMS type first, and then it kind of gradually goes into secondary progressive as they start to worsen. Primary progressive is also very similar, whereas it's another progressive form of MS. They're going to gradually get worse. There's just no remission period, like in the relapsing remitting type, where their symptoms become dormant or less severe. They're just not going to see that in primary progressive. As far as treatment, unfortunately, there's no cure, but there are a few options you can do. Medication or therapy are big ones to kind of cope with this disease and still live a good quality life. So therapy is a big one. Physical therapy and occupational therapy are going to be key, especially if you're experiencing the poor coordination, balance, weak muscles, or symptoms similar to that. They're going to be very helpful there. If they have speech problems, a speech therapist is also going to be very useful. Even meeting with a psychologist. A lot of them experience anxiety or depression just because it's a very stressful disease. So meeting with them a couple times can just improve their quality of life as well. Medication's another one. These are a list of the FDA-approved medications. These are common ones that are prescribed for people with MS. These are usually just going to be more of a control of their disease. It's going to lessen their severity or frequency of their symptoms. So it really just helps them keep things under control. A lot of these are anti-inflammatory drugs, so there's no real problem with exercising on them. There's not going to be some increase in heart rate or anything that we have to be aware of while they're on their medication. But just some things to note: they could have joint pain or back pain as a side effect. So that's just is good when you're going to be accommodating to them and you're thinking of their exercise prescription. Another common one is a nausea or flu-like symptom. Obviously, it's not going to prevent them from working out, but it is something to keep in mind. Maybe if they're taking their medicine in the morning, they might want to work out at night or something like that. When it comes to planning, it's just a good thing to keep in mind. But as far as just exercise in general with people with MS, there's no medical reason keeping them from working out. They are just as capable. They may just need some assistance, some modifications, adaptive tools, that kind of thing. But they're definitely capable of doing it. They'll just need a little extra special attention. The biggest thing, though, with exercising a patient who has MS is heat sensitivity is a huge thing. So as we know, when we exercise, our core body temperature is going to rise, and that rise in temperature can actually make people's symptoms worse. So depending on their symptoms, that can be very hard to work out with, so they have numbness in their legs. If they can't feel their legs, we don't want them out running and they're going to fall over because they can't walk. So we just have to monitor that as they're working out. Just try to keep them cool as best we can with, water and fans, that sort of thing. And then they should be all right. Other things to keep in mind, or just the general fatigue and pain that they usually can experience, poor coordination, balance, that sort of thing. Like I said, the symptoms are very dependent on the person, so this isn't going to apply to everyone who has MS. It's just a general guideline, just things to look at and be aware of. But why should they exercise? So it's just as important for them as it is for us. We all want to live a healthy, happy life, so we can do that by exercising because we want to prevent those metabolic diseases that come along with sedentary life. So the obesity, the hypertension, the cardiovascular disease. So it's just important for them to do it as it is for us because they don't want to develop any other type of diseases. Being physically active is also just going to increase their social well-being. Getting up and out, working with other people, interacting is just going to really help them feel better about themselves. Like I said, it's a very stressful disease, so, if they're coping with depression or something, that's definitely going to improve their social well-being, make them feel better about themselves. They also tend to have a lower aerobic capacity compared to a healthy adult, so aerobic exercise is going to be very important. The American Physical Therapy Association actually released a study that was done. It compared a 8-week aerobic training program, just a walking program, nothing high intense or anything, compared that to neurological rehabilitation and just seeing what had basically more significant results when it came to aerobic capacity. And based off of that, there was a greater increase when it came to the aerobic prescription. There was an increase in the walking distance, speed, maximum work rate, peak oxygen uptake. Those were all very important. So it's cool to see that actually had a better effect than the neurological rehab. So that's why we say exercise is medicine. It's only going to improve things. It's going to only help us out. Now let's look at a case study. So based off our risk stratifications, this person would be low risk. Pretty healthy. She was recently just diagnosed with relapsing remitting multiple sclerosis. Other than that, she's 32 years old, non-smoker, no family history, good BMI of 27, a little on the high end, but still good. 128/80 for her blood pressure, 162 for total cholesterol, and 104 for the fasting glucose. All good numbers. She also likes to swim and go jogging 2 to 3 times a week at the YMCA, so that's awesome, not sedentary. As far as medicine, she's only on Avonix, which is a interferon. It's a common prescription for MS, especially the relapsing remitting. Only side effect of that is the nausea, flu-like symptoms, and the skin reaction to the injection site, but that's not really going to impose on her exercise ability at all. So she wants to just remain active and maintain or gain muscle mass, which is good, and she wants to participate in a 5K mud run, Muckfest, which actually supports MS, raises money and awareness for the National Multiple Sclerosis Society. Looking at exercise testing, like I said, the aerobic capacity is going to be very big, so increasing that, we're going to want to do a max test first because they tend to have the low capacity based on their predicted measures. So figuring out what's actually their specific one is going to be very helpful in making our prescription. Bruce protocol test is going to be a good one to use. And then as far as resistance training, ACSM recommends an 8 to 10 rep test for muscular strength, or even a functional test, like a 30 seconds sit to stand test would be good as well. Balance and muscle stiffness are common with MS, like we talked about, so working them into your prescription is going to be good too. So doing board balance scale test prior to and flexibility test is also going to be very helpful. Moving on to exercise prescription. As far as aerobic training, ACSM recommends 3 to 5 days a week at 40 to 70% of their VO2 max, or between 11 and 14 for their RPE, scale out of 20 there. We want them exercising about 30 to 60 minutes a day, but it's important that we break it up, usually into 10 to 20 minute increments, keeping that heat sensitivity down, keeping that core body temperature from rising too much. So just doing shorter increments is going to definitely be beneficial for them. And using assistant equipment if needed, depending on their severity. Stationary bikes, handrails, that sort of thing are going to be really helpful. But anything, swimming, jogging, biking is going to be very, very good for them. Resistance training is going to be 2 to 3 days a week, about 60 to 80% of their 1RM. ACSM recommends limiting to about 1 to 2 sets, but doing 8 to 15 reps there, just mostly because of muscle fatigue. So if they have longer rest in between and just doing less of an exercise, they'll experience less fatigue that way. So the rest time is going to be key, though, so that they can have max recovery. Using the machines is going to be very helpful, too, since they might have the lack of balance or coordination. That machine is going to keep them in the same path the whole time, prevent injuries that way. But there's no restriction of using free weights or anything. It really just depends on the person and their severity. Like I said, everyone's prescription is going to be a little bit different. And then flexibility is also important. Muscle stiffness is common, so getting those muscles stretched and worked is definitely going to help them improve their range of motion, which is just going to affect their life in general. They're going to be able to do a lot more things, be less inhibited. So we're going to do that 5 to 7 days a week. 1 to 2 times a day is actually the best thing for them. Now we're going to hold the stretch until you feel some discomfort and do that for about 30 to 60 seconds, stretching all different muscle groups. Alright, and to conclude this, if you guys want any more information, the National MS Society's website's very helpful. They've got a lot of good stuff on there. And if you're looking to do anything to support this foundation, Muckfest is really cool. So, I mentioned that as my patient wanted to do that, but I actually did that myself. A good friend of mine, actually here on the left, her dad has MS, so we did this run in I guess the beginning of June. We did that kind of for him, in honor of him. That's why it's hard to see it through the mud, but our shirts say "Running for John." That is her dad. So really, really cool thing, a lot of fun. People with MS are there running the race as well, so that's really cool to see. But definitely something to look into. And that's it. Thanks.